What's up, beautiful people? Another day, another study. My family has a high genetic risk for migraines. I've talked about migraines a lot on the channel before. My mom, me, my sister have them, and it's a common condition that we see in the clinic. And I talk to patients about migraines like it's a hypersensitivity syndrome because everyone's triggers are different. We know that there are certain things that tend to be more triggering for more amounts of people, and finding out what those are paramount to creating an effective treatment and mitigation plan. So we know things like stress, that was a big trigger for me, lack of sleep, that was a big trigger for me, and then diet quality, big trigger for me. So all of these things I've seen both in myself and with patients that improving these markers can dramatically improve their migraine frequency and severity. Another thing can be fluctuating meal timing patterns. So I'm a big proponent of trying to control and keep the same as much of your day as possible. And meal timing is one of those things. I try to eat around the same time every single day. Fluctuating meal timing patterns may be a trigger for someone's migraines. The mechanism is thought to be due to fluctuations in brain glucose levels. And then during periods of high demand, there's not enough nutrients or energy available to meet tasks relate, and this causes a release of stress hormones like cortisol and noradrenaline, which leads to overexcitation of the nerve cells in the brain, the neurons, and this can trigger a migraine. Other dietary triggers include chronic overconsumption of calories, leading to hyperinsulinemia. We talked about dietary quality, so higher intake of ultra processed foods, high fat foods, things like processed meats, alcohol, high fat foods, caffeine, especially if it's excessive caffeine intake. All of these can trigger migraines in certain individuals. So of the 36 studies included, only one was a randomized controlled trial. In general, the studies were mixed, but more often than not, they reported that missing or skipping meals, including breakfast, may trigger migraine episodes. And this is thought to be due to that low blood sugar that I mentioned earlier, while others do not. The randomized controlled trial and some of the systematic reviews and of observational studies pointed towards regular meal timing possibly being a preventative factor from migraine headaches. I saw this with myself. My migraines improved once I started to have regular meal timing and stopped doing intermittent fasting. But these studies were not the highest quality, so it limits the strength of conclusions that can be drawn. And I think that's okay because, like I said, these things can be highly individualized. And so I think it's important for people who have migraines to keep symptom journals, be introspective, help us try to figure out what their triggers are so we can have a plan for those triggers, and then have a plan to mitigate or prevent these migraines if we can. For me, my migraines, I have aura, so I usually feel them when they're about to come on. I get like not dizzy, but feel kind of unstable. I see the halos around lights. I get nauseous. So I can feel like an impending migraine. And what works really well for me, and I've seen it work well for other people, and there is some literature to support this, is exogenous ketones. So I will take an extra packet if I feel a migraine coming on. Now, luckily, I was migraine free for about a decade and a half until Trey was born, and then stress and lack of sleep caused the migraines to come back. However, they're gone now. So this is something that can be effectively treated and mitigated, but finding out what your triggers are and having a plan for those triggers is very, very important.